A child present to pediatrician with history of fever, rash, cough, coryza, and pediatrician also noticed a coplic spots in his mouth. What could be the diagnosis? Chickenpox, measles, mumps, or is it rubella rash? We all know that whenever we see the coplic spots, that is spots surrounded on the erythematous base, it means it is measles. So the correct answer to this question was measles. A 10-year-old child who is going to school presented to pediatrician for the vaccination. Which vaccination to be given to this child? Is it typhoid, hepatitis A, rabies, or TD? According to the Universal Immunization Program, this child should receive TD vaccine. Welcome back to my channel. In today's video, we are going to solve many MCQs of pediatric subjects, NEET PG 2023 March recall questions. Do not skip anything, watch till the end. And if you are knowing any more MCQs, please do write in the comment. Hi, I am Dr. Triya Malde, pediatrician and consultant neonatologist. I'll be your guide for pediatric subject. If you are new to my channel, please do subscribe and give like to this video because lot is going to happen for pediatrics on this channel. A child is being evaluated with muscle weakness, flaccidity and low IQ with developmental delay. On evaluation, cherry red spots were noted in the macula and there was no hepatospleenomegaly. Which among the following is the likely diagnosis? So let's see. Could it be Niemann-Pick? As there is no hepatospleenomegaly, this option is out. No organomegaly as well as the presence of cherry red spot is pointing toward Tay-Sachs disease. What about Von Gogh? Von Gogh will also present with hepatomegaly. So there is no organomegaly, so this option is also out. Similarly, Gaucher disease will present as hepatospleenomegaly. So this is also not option over here. Cherry red spot and no hepatomegaly. As we all discussed that Niemann-Pick will have hepatospleenomegaly. Yes, Tay-Sachs could be the possible diagnosis because there is no organomegaly. Von Gogh will present with hepatomegaly and Gaucher disease will present with hepatospleenomegaly. Here the correct answer is Tay-Sachs disease. Tay-Sachs disease is GM2 gangliocytes. Sendorf's is also GM2 but it will have a hepatosplenomegaly. In Tay-Sachs disease the child will be developmentally normal, the birth history will be normal. This is also very important question. It was asked last year that exaggerated startle response, that is hyperacusis, could be the earliest symptoms in child of Tay-Sachs disease. There will be a macrocephaly but there is no hydrocephalus and there is no treatment available. The life expectancy is up to 1 to 2 years. The next question was very easy from the section of neonatology, that RDS is deficiency of which of the following? Lecithin, sphingolin, phosphatidyllithanoalamine, or all of the above. We all know that surfactant is a phospholipid protein and its major constituent is dipalmitoyl phosphatidylcholine, that is lecithin, phosphatidylglycerol, apoprotein as well as cholesterol. So we all know that correct answer is option A, lecithin, that is methylphospholipid. The next question was also from neonatology, that RDS is associated with, this was also asked 2 or 3 times earlier. The options were A, decreased surface tension, low lung compliance, increased surface tension and low lung compliance, increased surface tension and increased lung compliance, decreased surface tension and increased lung compliance. So RDS is basically happening because of deficiency of surfactant. So what does surfactant do? The surfactant will reduce the surface tension. As it is shown in this figure, it will reduce the surface tension. At the same time, it will improve the lung compliance. So here the correct answer is the deficiency of surfactant will lead to increased surface tension and low lung compliance. The next question was, which of the following is normal in infant? I have also found that what is the best sign of growth in an infant. So it could be either way. If you know the correct question, please do write in the comment box. The options were anterior frontal closes by 6 months, 25 centimeter length gain in the first year. We all know that anterior frontal closes by 18 months, not 6 months. So this option is incorrect. 25 centimeter length gain in the first year. We all know that at the time of birth it is 50, then in the first year it is 75. So there is gain of 25 centimeter in the first year, that we all know. So this option is correct. 300 gram weight gain in the first 5 months, that is incorrect, because the birth weight will double by the age of 5 months. So around 2.5 kg child will be 5 kg by the age of 5 months. So this option is also incorrect. Ideal length is between 25th and 75th centile. This is also incorrect, because ideal length should be between 3rd to 97th centile. So correct answer to this question was option B, 25 centimeter length gain in a 1-year-old girl with recurrent episode of fasting hypoglycemia presented to pediatrician. Liver biopsy reveals no or minimal glycogen deposits. Which enzyme deficiency is associated with this condition? First of all, fasting hypoglycemia is pointing towards metabolic disorder. There is issue with the glycogen synthesis over here, because the liver biopsy doesn't show any kind of glycogen. So here there is a deficiency of glycogen synthase enzyme, that is GSD type 0. So correct answer is option C, glycogen synthase. Now what is GSD type 0? It is liver glycogen synthase deficiency, fasting or early morning hypoglycemia, and it is associated with recurrent episode of hypoglycemia. Most common type, we all know that it's von Gurk disease, which is associated with hyperlipidemia and hepatomegaly. The type 0 is rare. This is from the Nelson textbook of pediatrics. It says that type 0 is rare in human. It is not even a type of GST, because glycogen is not getting synthesized, is not produced at all. So no glycogen store in the liver is pointing towards this deficiency, that is type 0, and there is deficiency of enzyme glycogen synthase. The next question was very classical from the intrauterine infection torch. Catract, deafness and PDA. It was like the baby presented with the machinery murmur and PDA was diagnosed. Along with that, there was a cataract and deafness. Is likely due to which of the following congenital infection? Is it toxoplasmosis, rubella, CMV or congenital syphilis? We all know that the classical triad of rubella is mentioned over here, that is cataract, deafness and heart disease, congenital heart disease, that is PDA. So correct answer to this question is congenital rubella syndrome. A baby weighing 1 kg was born at 36 weeks of gestation to a 23 years old female. Baby had petechia, jaundice, hepatospleenomegaly and periventricular calcification on CT scan. Urine shows also als eye inclusion. What could be the diagnosis? Here also it is a very classical presentation of petechia, hepatospleenomegaly, jaundice. A child is IUGR because at 36 week we are expecting the weight of at least 1.8 to 2 kg, and urine shows als eye inclusion. So here it is classical of CMV infection. It was very straightforward question. The correct answer to this question is CMV infection. Next question was 2 months old infant presented with swelling since birth. What could be the diagnosis? Now here we can see the swelling which was localized over here. Right? Encephalocele will have a localized swelling, but the swelling will not have a radiopacity. The swelling will be looking like this. It will have a radiolucency. The second option is caput succedatum, will resolve in 3 to 4 days, although it presents since the birth, but it will resolve within 3 to 4 days of the life. So this is also not scenario where it could be Cephalhematpoma, although it can present after 3 to 4 days of life, but it will stay for it can stay up to 4 to 8 weeks of the life. So this is a scenario. Subgaleal hematoma will give a diffuse swelling. So here it is localized. So this option is also out. So correct answer to this question is option C, Cephalhematoma. Next question is a child with history of decay. Finding is pH 7.01, bicarb 7 millimole per liter. There is presence of glycosuria +3. There is a presence of glycosuria plus 3. Glucose is 550 milligram per deciliter. Child also has a feature of shock. As per ISPED is the International Society of Pediatrics and Adolescent Diabetic Guidelines. Initial treatment is, your options were initial ABC resuscitation with 10 ml per kg fluid with 0.1 IU per kg insulin transfusion. Initial ABC with 10 ml per fluid with later insulin transfusion. Initial ABC 20 ml per kg fluid with 0.1 U kg insulin transfusion, or is it initial ABC with 20 ml fluid with insulin transfusion after 1 hour? So first of all, it's a shock. So we all know that in shock we need to give a fluid of 20 ml per kg in case of decay. So either it is C or D. So now only one thing we need to decide: insulins to be started at the same time or it should be started later. This is not a whole of the ISPED guideline, but this is just a part that if there is a presence of shock, 0.9% NS should be given 20 ml per kilo. We have to correct the fluid deficit, we have to add the potassium, and then after 1 hour we have to start with the insulin. Here there are 3 categories: shock, moderate to greater degree of dehydration, or minimal or no dehydration. In case of minimal dehydration, there is only oral therapy as well as SC insulin. If there is no improvement, then only we have to shift to this limb. But in case of shock, initially we have to give with the bolus of 20 ml per kilo, and then later we need to start with the insulin. So correct answer over here was ABC, along with the 20 ml per kilo bolus with insulin later. The next question is, in a child presenting with bone pain and anemia, bone marrow aspiration was done, which reveals the crumpled tissue paper appearance. The minute we see this line, we all are happy. Which enzyme deficiency is associated with this condition? I hope that you all tick this question correctly. It's a glucocerebrosidase deficiency. It's Gaucher's disease, because in Gaucher's disease we have a crumpled tissue paper appearance. Most common lysosomal storage disorder is deficiency of glucocerebrosidase. Distended phagocytes are called Gaucher cells. Cerebral involvement is there, in which the Gaucher cells are seen in virtual Robin space, and bone marrow accumulation will give symptoms of anemia, thrombocytopenia, as well as flask-shaped deformity of the long bone, that is called Erlenmeyer flask deformity on the X-ray. What this image suggests you of? Options were AML, M2, M3, 1 or M7. What is shown over here? It's like a bundle of stick appearance over here, as shown in this figure. The correct answer is option B, AML, M3. There are numerous OR roads are seen. This will give the bundle of stick appearance. This is called fagots, and it present with DIC. DIC is also 3-letter word, and M3 is also number 3. So that the way we can remember it. So here the quick revision of the classification. M0 is undifferentiated or minimal differentiated. It's OR road negative, poor prognosis. M1 is myeloblastic without differentiation. M2 is myeloblastic with differentiation. Here, whenever we see the word chloroma, along with this translocation 821, MPO positive and OR road positivity is M2. While M3 is APML, here we have a T15-17 translocation, PMAL, RARA or road positive, as well as DIC is present, MPO is positive, and fagot cell. As we have seen in the previous slides, the picture of the stick, the bundle of stick appearance, that is called fagot cells, which is present in M3. M4 is myelomonocytic, M5 is monocytic, M6 is erythroleukemia, and M7 is megakardioblastic, that is myelofibrosis, and it is associated with Down syndrome. Our next question is, a child with jaw swelling and translocation 814, diagnosis is the minute we see the jaw swelling. Neck swelling is just because of lymphadenopathy. Along with this typical translocation of 814, we all know it is non-Hodgkin's lymphoma. One of the most important thing with swelling and translocation is Burkitt's lymphoma, that is non-Hodgkin's lymphoma. It will have a starry sky pattern, which is shown here. It is scattered tingible body-laden macrophage containing dead tumor cell. It is aggressive non-Hodgkin's B-cell lymphoma. It is associated with EBV, HIV as well as the 814 translocation. It will present with jaw swelling, axillary swelling or inguinal region swelling because of lymphadenopathy. The presenting symptoms could be fever, fatigue, anorexia as well as weight loss. The next question was zinc deficiency can lead to, this was also very easy, that could it lead to acrodermatitis enteropathica? Yes, we all know Menkes disease, bleeding gums or Maper syrup, urine disease. We all know that it is present with the acrodermata, enteropathica as well as growth failure, low immunity, poor wound healing, diarrhea or maybe upper respiratory tract infection. While Menkes disease is happening because of deficiency of copper, bleeding gums could be a part of collagen synthesis problems and seen with the vitamin C deficiency, and MSUD is one type of IEM. So here the correct answer is option A, acrodermatitis enteropathica. It is also called Branded syndrome or Denbolt-Cross syndrome. It's a triad of alopecia, diarrhea and dermatitis. Could present with paronychia also, and there could be a secondary infection with Staphylococcus aureus as well as Candida albicans. It is autosomal recessive disorder. There is problem with uptake of zinc because of this gene problem. Acrodermatitis enteropathica, it says it means the rashes are over the all orifices, perianal, perioral, all the areas which are having mucocutaneous junction, those are involved, and it requires high dose of zinc lifelong. The next question was also related to vitamin. Which of the following coagulation factor contains gamma carboxy residue of glutamine? Now we all know that the minute we read the carboxylation reaction, only one vitamin will come in our mind, that is vitamin K. And whenever we see the vitamin K in any question, we know that 2, 7, 9, 10 are the factor which are dependent on the vitamin K. So the question was asked in a different language, but the answer was straightforward, that clotting factor 2, 7, 9, 10 were responsible for vitamin K and carboxylation. So here is the quick revision of the biochemistry of vitamin K. Vitamin K is required for the carboxylation, coenzyme like activity for protein carboxylase. Glutamate residue is converted to gamma carboxy glutamate residue, which is vitamin K dependent reaction, and it is required for the formation of the active clotting factor 2, 7, 9 and 10. Next question is, child presented with cardiomegaly, pedal edema and pleural effusion, which test to be done for the diagnosis of vitamin deficiency? These all features points towards wet beriberi. This question is also from the section of vitamin. Wet beriberi will have a presentation like CCF, so it is vitamin B1 thiamine deficiency, and whenever we are dealing with the thiamine deficiency, a more specific is the RBC transketolase. So the correct answer is option B, transketolase. So vitamin B1 thiamine deficiency, beriberi, wet or dry. This picture was suggestive of a wet beriberi. One more important thing has to be remembered, that ECG can have a prolonged QT interval here, and the risk factor could be high amount of rice consumption. Excess amount of cow's milk will lead to iron deficiency. Excess raw egg will lead to biotin deficiency. Polished rice deficiency, polished rice consumption will lead to riboflavin, and the maize, excess of maize will lead to niacin deficiency. The next question is, a patient presented with diarrhea, dermatitis and dementia. This is also a very classical question. Which vitamin deficiency can lead to? These are 3Ds. So it is pellagra, 3Ds. It also have a Castle necklace. 1 milligram niacin is equal to 60 milligram of tryptophan. So correct answer over here is niacin. And the next question was from the vitamin. A child present with the thinning of hair along with some of the red erythematous scaly lesion with history of raw egg ingestion in the mother in antenatal period, which vitamin deficiency can lead to this feature? Whenever we see raw egg, it should strike to us that raw egg is having avidin, which inhibit the biotin absorption from the intestine. So what are the other factors could interfere with the biotin absorption is high dose of valproate as well as the prolonged TPN. The symptoms could be alopecia, conjunctivitis and hypotonia, erythematous rash, as well as it could present as a peri or oral dermatitis. So here the correct answer is biotin. The next question was also very much straightforward from the section of vitamin. A child present with the leg deformity as shown in this picture. This is a bowing of leg, which is called genu verum. Genu verum, genu valgum and windswept deformity is very much seen along with the vitamin D deficiency, that is rickets. So vitamin D deficiency can lead to genu verum, valgum or a windswept deformity. Easy to remember, we need to remember verum contains the bottle of rum. So here the bottle of rum will get fit between these two knees. And valgum is a bottle of gum. Here because of the gum, the knees are stuck together. So it is called also knock knee. And one leg will have a valgum deformity, another will have a verum deformity, then it will lead to the windswept deformity. This all three could be because of vitamin D deficiency. We all know that it could lead to deformity of the bone because of various mechanisms. What other symptoms could be there in a vitamin D deficiency? It could present as a rickety rosary. Rickety rosary. Rosary is a religious bead which is used by many religions for the purpose of worship. These are the prominence of the costochondral junction, which is non-tender, could be part of a rickety rosary. The attachment of the diaphragm will be very much clear because of a deformity of the ribs, which is called Harrison sulcus. There could be a deformity of the chest, which is pectus excavatum. We all discussed genu verum deformity. Presence of short stature, which is disproportionate. The earliest symptoms in an infant could be a wrist widening, frontal bossing with appearance of hot cross square bun, craniotabes, which is the first sign in 6 months of the life, that is softening of the scalp bone, and there could be a delayed teeth eruption. These are radiological signs of the vitamin D deficiency. Presence of cupping, splaying and the fraying. Loss of provisional zone of calcification is the first radiological sign in case of rickets. So next question is a child present with bleeding gums and this occurs due to defect in collagen synthesis, vitamin D deficiency, vitamin A deficiency or both A and B. Do not tick both A and B because we all know that correct answer to this question is collagen synthesis. Vitamin C is important for the hydroxylation reaction, and proline to hydroxyproline and lysine to hydroxylysine is occurring because of ascorbic acid and vitamin C, which is a very important for the formation of the collagen. And when we see the collagen, there are this many types of collagen. One is for bone, so poor bone growth and periosteal bleeding is seen in the scurvy. 2 is for cartilage. 3 is for the blood vessels. So petechia could be there and bleeding gums could be there. 4 is under the floor, which is for the connective tissue of the gum. This can also lead to gum bleeding. And 5 is for the hair and placenta. So what are the other features that can point towards the scurvy? It could have a swelling of the joint which is tender, which will lead to pseudoparalysis, and child will be in a frog-like posture, which is shown here. The manifestation of the symptoms is between 6 months to 2 years. Scurvy will also present as a scorbutic rosary, which is also seen here, but here it will be tender and baby will be screaming while changing the diaper. That could be the sign and the presenting complaint by the parents. There could be a presence of petechial hemorrhage, bleeding gum, subconjunctival hemorrhage as well as ecchymosis. So that's all about today's video. I'll be back with more of the MCQs by Recall 2023 NEET PG Pediatric questions. Till that time, take care of yourself, study hard and study smart, who are going to appear for the NEET PG exam for the next year.